Hello guys, we are going to talk about another class of antibiotics called tetracyclines. Tetracyclines are broad antibiotics. They are used in the treatment of different bacteria or microorganisms. They are broad spectrum antibiotics, meaning they are used in treating different types of bacteria or microorganisms, such as chlamydia, rickettsia, brucella, spirochetes, borrelia bancrofti. The tetracycline drugs include doxycycline, oxytetracycline, and tetracycline. They include doxycycline, oxytetracycline, tetracycline. Tetracycline is more preferable than doxycycline. It is deposited in growing bones and occasionally stain the teeth. Doxycycline. Classification. Let's talk about doxycycline. Classification. Doxycycline fall under the class of tetracycline or tetracycline antibiotic or antibiotic. It's a broad spectrum antibiotics. Indication. It is used in the treatment of respiratory tract infections, e.g. pneumonia, chronic bronchitis, urinary tract infection, e.g. syphilis, chlamydia. It is used in the treatment of mycoplasma and rickettsia, prostatitis, inflammation of the prostate gland, lymphogranuloma, venereum, pelvic inflammatory disease, typhoid, cholera, plague, malaria. Contraindication. It is contraindicated for pregnant women, children, porphyria, systemic input, systemic lupus erythematosus, renal impairment, hepatic impairment, and breastfeeding. Dosage: adult and child over 8 years. Take 200 mg on the first day, then 100 mg daily in severe infections. 200 mg daily. It comes in capsule per oral, 100 mg. Side effects. The side effect of doxycycline: gastrointestinal disturbances, anorexia, erythema, photosensitivity reactions, headache, and visual disturbance, hepatotoxicity, blood disorders, pancreatitis, antibiotic associated with colitis, staining of growing teeth, which is common in neonates. Nursing implications: obtain specimen for culture and sensitivity prior to first dose. After obtaining the specimen, the dose can be commenced. Administer drug with meals, that's with full stomach, after meal, to decrease GI upset. You can give the drug with full glass of water. Tablet or capsules should not be given within an hour of bedtime because dysphagia may occur. Give drug 2 hours before or after laxative or iron product and 3 hours after antacid or kaolin pectin product. Antiemetics may be given if nausea and vomiting persists. The next one is tetracycline. Tetracycline is another class of drug that fall under the class of drug tetracycline, antibiotics. Mode of action. Tetracycline exert bacteriostatic effect by binding to 30S ribosomal subunit of microorganism, thus inhibiting protein synthesis. The 30S ribosomal subunit is in spiral shape, which are numbered sequentially from 1 to, some are up to 60, some 100. We have 30S ribosome. At the 30S ribosome, the drug bind at the 30S ribosome and inhibit protein synthesis. The organism depends on protein. That is the blood, plasma. And when this is inhibited, it results to bactericidal or bacteriostatic effect of the drug on the microorganism. Indication. What condition do you give tetracycline? Infection of the ear, nose, throat, respiratory tract infection, gastrointestinal tract disease, liver disease, genitourinary tract disease, venereal disease. Contraindication. Do not give the drug to patients that are hypersensitive to the drug. Pregnancy, children under 12 years, kidney disease, systemic lupus erythematosus, breastfeeding, penicillin therapy. Dosage by mouth 250 milligram 4 times daily. Increase to 250 milligram 6 to 8 times daily in severe infection. Side effects: gastrointestinal disturbance, overgrowth of resistant organism, photosensitivity reaction, dermatological reactions. Nursing implications. Obtain specimen for culture and sensitivity test prior to first dose. Adhere to the right drug timing. Administer on an empty stomach with a full glass of water. Administer the drug on an empty stomach with a full glass of water. Separate iron product, antacid, dairy product, or kaolin by at least 2 hours from the drug to prevent counter action of the tetracycline. Give at least an hour before bedtime to prevent esophagitis. Antiemetic may be given if patient has nausea and vomiting. Educate patient that milk or other daily product, food or antacid reduce the effectiveness of drug. The drug should be separated from them. Monitor patient for super infection. Thank you for listening. Always like, watch for information, subscribe, and make comment. You are free to ask any question. Thank you.